and this is the last section of session 10, where we look at some clinical pointers. According to Morrison, in daily homeopathic practice, we commonly encounter chronic prostatitis and also benign prostatic hypertrophy. Now, for chronic prostatitis, which is an acute condition, acute inflammation, there is said to be no good allopathic treatment. And homeopathy can help, and he says that homeopathic treatment used in chronic prostatitis responds very well to homeopathic medicines. And he says that the cause of chronic prostatitis is usually suppression of a simple UTI infection, maybe by antibiotics or whatever the suppressive treatment may be, results in chronic prostatitis. And he says that the symptoms, or in conditions like chronic prostatitis, you do not get very good symptoms because of this long history of suppression. And it's important to question the patient as to what their symptoms were like prior to starting antibiotic treatment. Now, in homeopathy, whether it be chronic prostatitis or benign prostatic hypertrophy, both of them share the same symptoms, and therefore the remedies that we'll be using would be the similar ones. But what you have to be aware of is that in chronic prostatitis, if there is suppression of urine due to prostate hypertrophy, then it's a serious condition, depending on how much of suppression of urine there is. So if it is severe, then you want to try your homeopathic medicine, and if you don't find any response within the first 24 hours, then it's better that you send them off to a urologist or to an A&E. Don't keep changing the medicines and saying, okay, if I just hit the right one, I will get it. Although if you do get the right remedy, even at 30C within 3 to 4 days will help elevate the symptoms of the condition. Okay, so remember, in cases of severe obstruction, do not take any chances. Within 24 hours, if your medicine does not work, if there is no improvement, please refer the patient on. Now, non-homeopathic tips is said to be manual massage of the prostate on a weekly basis. And Morrison says that it can have a dramatic effect in the rapid cure of prostatitis. Now, other than this, some of the other things that you could, if you're qualified to do, could also be inclusion of vitamin C, zinc, vitamin B complex. These are the things that you could consider for in conditions of prostatitis or prostate hypertrophy. Now, in benign prostate hypertrophy, which is something that most clinical practitioners of homeopathy will see, is to give a constitutional remedy based on the totality for their condition. Okay, so or another thing which sometimes I tend to do is also take a case of only their symptoms of prostate hypertrophy symptoms, like whether there is urgency, less urgency, or whether there difficulty in starting to urinate, whatever the symptoms may be, prescribe on that, and as an intercurrent give a remedy based on their totality, or what we call as a constitutional prescription, if it is clearly visible. Okay, the potencies that we would use in cases of chronic benign hypertrophy would be lower potencies, because you need to repeat them over a period of time. Yeah, so it would be a 6C or a 12C or Q potencies. Some of the herbal medicines that may be quite effective would be saw palmetto, and also pygeum extract. These are the more commonly used one in prostatic hypertrophy. In conditions of premature ejaculation and others problems like that, it's better to give a remedy, a constitutional prescription remedy based on the totality, and judge the vitality. The potency selection would be based on your judgment of the vitality of the patient.